Today, I will talk on bearing surfaces in total hip arthroplasty. The so-called bearing surfaces, highly cross-linked polyethylene, ceramic and ceramic, and metal on metal, were developed to address the known limitations of conventional polyethylene in a total hip arthroplasty, namely wear-related osteolysis and eventual component loosening. With almost 2 decades of clinical follow-up now available, we can resolve several controversies regarding the relative performance of these bearing surfaces. Each bearing surface has a distinct set of advantages and disadvantages, and for that reason, a consensus on the appropriate use of each is unlikely to emerge in the near future. The most commonly reported bearing was metal on polyethylene, 51%, followed by metal on metal, 35%, and ceramic on ceramic, 14%. The usage of total hip arthroplasty bearings varies considerably by patient characteristics, hospital type, and geographic location throughout the United States. This was study published in JBJ's 2009. I think now metal on metal would be much lesser in 2020. There does not appear to be any role for conventional polyethylene in a contemporary total hip replacement in light of the lower revision rates and superior wear characteristics of the highly crossed polyethylene. At 7 years follow-up, study published in COR 2015, the cumulative incidence of revision was 5.4% for metal on conventional, 2.8% for metal on highly cross-linked polyethylene. There was a higher adjusted risk of all cause and aseptic revisions among metal on conventional polyethylene bearing surfaces compared with metal on highly cross-linked polyethylene. Metal on conventional polyethylene total hip arthroplasty bearing surfaces have a higher risk of revision than metal on highly cross-linked polyethylene. This is a study from US registry. The role of metal on metal bearings in a total hip replacement appears to be extremely limited. Histological features suggestive of an adaptive immune response appear to be more frequent and of a greater magnitude in a failed metal on metal implants, but tissues around many failed metal on metal implants show features of an innate foreign body reaction without lymphocytosis. There is no role for metal on metal nowadays. Comparison of 10 years survivorship of hip prosthesis with the use of a conventional polyethylene, metal on metal, or a ceramic on ceramic bearings. When comparing two groups of patients of a similar mean age and mean activity level undergoing a total hip arthroplasty with the use of alternative bearings, cobalt chromium bearings had a better survival than did metal on metal bearings at 10-year follow-up. The difference was significant when the revision for aseptic loosening was defined as a failure. However, neither the COCA nor the metal on metal alternative bearings provided improved midterm results when compared with the results of the conventional metal on poly bearings. For older, less active patients, traditional metal on polyethylene bearings are the appropriate choice. Metal on metal, Australian Orthopedic Association National Joint Replacement Registry. Arthroplasties involving both ASR metal on metal designs had a significantly greater revision rate compared with those involving all other prostheses. ASR prosthesis used in a conventional hip arthroplasty and in hip resurfacing exhibited a greater revision rate compared with other prostheses. Metal on metal. The release of cobalt and chromium ions from bearing surface wear, corrosion or both can lead to the development of adverse local tissue reactions and or systemic effects related to elevated blood levels of these metals. Given the outstanding performance of other bearing couples, these risks seem to be unacceptably high outside of a rare cases such as when a metal on metal hip resurfacing allows the surgeon to better manage severe proximal femoral deformity that precludes the use of a femoral stem. Highly cross-linked polyethylene, when paired with either metal or ceramic femoral heads, is justifiably the acetabular bearing surface of choice due to largely the following factors: low rates of revision, excellent wear properties, intraoperative flexibility, head diameters, elevated rim, offset liners. When cross-linked polyethylene liners are used, surgeons have a much wider array of intraoperative choices with regard to head size. Orientation. Head size you can use 28, 32, 36, 40. Orientation 0, 10, 20 degree elevation and offset. Standard or lateral offset. Lower cost than COC bearings. COC bearings. It is important to note that COC bearings continue to perform quite well with very low rates of revision or wear related issues. However, more widespread use of COC bearings is limited by higher cost, fewer intraoperative choices, lack of offset and elevated ceramic liners, and implant squeaking, and the potential for catastrophic failure related to bearing fracture. Rhomionosis. Currently, the femoral side of the total hip replacement bearing surfaces commands the greatest attention, although the risk associated with the cobalt and chromium release are greatest with the metal on metal bearings. These same complications can be seen whenever a cobalt chrome is present at the modular junction. The incidence of this so-called prunosis is not yet known and is currently under careful consideration. Corrosion at the head neck taper as a cause for adverse local tissue reactions after total hip arthroplasty. Adverse local tissue reactions can occur in patients with the metal on polyethylene bearing secondary to corrosion at the modular femoral head neck taper, and their presentation is similar to the adverse local tissue reactions seen in patients with the metal on metal bearing. Conclusion: more widespread use of both COC, ceramic and highly cross-linked polyethylene bearings has resulted from greater recognition of this potential complication. Further study is needed to clarify the role for metal on highly cross-linked polyethylene, ceramic on highly cross-linked polyethylene, and COC bearings with respect to long-term outcomes and financial impact.